I'm Dr. Frita. I'm a board certified kidney doctor, and today I'm talking to you about 7 common horrible habits that can cause kidney failure. Number 5 is hard to quit. Most people don't think twice about popping a pain pill or grabbing a protein bar on the go. But the truth of the matter is that many of these everyday choices can actually be causing harm to your kidneys. It's true. Over 35 million Americans have kidney disease, and if you do have chronic kidney disease or CKD and it's left untreated or unmanaged, it could lead to you being on dialysis or needing a transplant. So, of course, most people want to prevent kidney disease or at least to reverse it, right? Well, here's the issue. There are so many common everyday habits that can actually cause kidney failure. And even if you think that these habits are healthy, sometimes they can actually be harmful. That's frightening, right? Well, don't be scared because I'm here to help. Today, we're going to talk about it. I'm giving you 7 common, horrible habits that can cause kidney failure. Keep watching. Be sure to download your copy of my book. It's called Under Pressure. It's your step-by-step guide on how to control high blood pressure. This book is packed with valuable tools, guidelines, and information to help you to control high blood pressure. Click the link in the description to get your copy today. I'm Dr. Frita. Please click the like and subscribe button as we get started because I'm about to give you some evidence-based medical information about some habits you might have that could be harming your kidneys. Your kidneys are so important. You are born with 2 kidneys and they're located in your lower back, your flank, where the love handles are, and your kidneys are responsible for filtering your blood. They filter your blood to get rid of excess toxins, excess fluid. Your kidneys are also responsible for helping to keep you from being anemic. They help to keep you with having good bone health. They help you to have proper vitamin D. Your kidneys also help to regulate your blood pressure. So yes, they're very important. In knowing this, most people try to protect their kidneys. Even you. I'm sure that you have lots of habits that you think are healthy for your kidneys, but the truth of the matter is that many people have common habits that they think are healthy, and these habits can actually be causing kidney failure. How do I know? Because I'm a board certified kidney doctor and I see patients every day who have habits that have caused them to see me. It sent them to my office with kidney disease, and they really thought that those habits were healthy. So today, I'm going to share some of those habits with you. So please go ahead, hit the like button because we're about to get into some of these common, horrible habits that can actually be worsening your kidney health. Number 1, abusing over-the-counter pain medications, specifically NSAIDs. So what are NSAIDs? Non-steroidal anti-inflammatory drugs like ibuprofen, Advil, Motrin, naproxen. The thing is, taking these drugs definitely is a very common habit because they're very effective for inflammation and for pain. And so it's nothing for someone to take a little Advil for a headache or some naproxen for cramps or for arthritis. And truth of the matter is that if you actually have healthy kidneys, then it is okay to occasionally take some of these pain meds. The problem is if you take too many of them, okay? If you're taking above the recommended dose and if you're taking them over long periods of time very frequently. Also, if you already have kidney disease, CKD, or if your kidneys are susceptible to kidney failure, like if you're really dehydrated, if you have hypertension, if you have diabetes, if you have other things that put you at risk for kidney disease, and you're taking a lot of these pain medications, these NSAIDs, then it can definitely put you at risk for kidney failure. Here's why. The nonsteroidal anti-inflammatory drugs actually constrict your blood vessels that supply your kidneys, okay? They cause a decrease in the blood flow and the oxygen to the kidneys, and this can lead to kidney failure over time. So here's what you can do instead. Number 1, even if you have healthy kidneys, make sure you consult with your doctor and make sure that you follow the directions and that you take the NSAIDs in the recommended dose. If you already have kidney disease or if you are susceptible to kidney disease, then try an alternative to the NSAIDs. Try taking acetaminophen, which is the generic Tylenol. Consult with your doctor. Also, make sure that you have adequate hydration, that you drink enough water, because being dehydrated and taking these pain medicines, these excessive amounts of NSAIDs, can definitely lead to kidney disease. The other thing that you can try is some alternatives to taking medicine in order to manage your pain. Consult with your doctor about physical therapy, stretches, acupuncture even, cold or hot compresses. Bottom line, if you find that you're someone who takes medications every day for headaches, every day for arthritis, then you want to make sure that you're not abusing these over-the-counter pain medications, because again, this is one habit that can lead to kidney failure. I will say that I actually have had to put people on dialysis just for using too many NSAIDs. It's called NSAID nephropathy. And typically it's someone who has bad arthritis and they're taking like ibuprofen over the counter every day or naproxen every day, or someone who's got rheumatoid arthritis or migraine headaches. And so if you're someone who is in chronic pain and you're listening to me and you know that you're taking a whole lot of these over-the-counter pain meds, please be sure to consult with your doctor and ask about your kidney function. I love making videos like this and sharing evidence-based information with you. But do you ever have follow-up questions? Do you ever want to ask me personal questions about your own health? If so, you're in luck, because I do offer a telehealth concierge service. That way we can have a one-on-one consultation from anywhere in the world. I am a quadruple board certified medical doctor. I'm a board certified kidney doctor. I have also been board certified in internal medicine, pediatrics, obesity medicine. So if you click the link in the description and sign up for a telehealth concierge appointment, you will have access to me, to all of the knowledge I love to gain, and we can just have a real one-on-one conversation about you. Number 2, extreme dehydration or extreme overhydration. That's right. Too much or too little of anything just really is not a good thing. So let's start with the dehydration. It's a little known fact that being dehydrated can actually cause kidney failure. And is being dehydrated a common habit? Yes. A lot of people go all day without drinking water. Or if you're traveling, if you're on a road trip, you don't drink a lot of water because you don't want to have to keep stopping. And so being dehydrated actually is a common habit that can cause kidney failure. Here's what happens. If you don't drink enough water, then you don't have enough perfusion, oxygen, blood flow to your kidneys, and your kidneys become dehydrated. When the kidneys become dehydrated, then they begin to work poorly. This is called pre-renal azotemia. And I've actually had to put people on dialysis due to extreme dehydration. I'll give you an example. It's happened over and over again, but a lot of times nursing home patients. If you're a patient in a nursing home, and let's just say you have some memory loss or dementia, well, you might not remember that you're thirsty. And unless you have someone who's watching over you, making sure that you're drinking a lot of water, then over time, days, weeks, months, you can get extreme dehydration. And I've had nursing home patients come in and they were so dehydrated that even giving them IV fluids was not enough. I've had to dialyze them. And guess what? I've had healthy young patients, yes, athletes who've been out and about in the sun, wearing lots of equipment like football equipment, and they've gotten severely dehydrated to the point where they have needed dialysis as well. Extreme dehydration can cause kidney failure. Now, on the flip side, overhydration or drinking too much water can cause problems as well. When you overhydrate, when you drink excessive amounts of water and you're drinking more water than your kidneys can get rid of, then this can cause your blood to be very dilute, and it can lead to the salt concentration being low, hyponatremia. Why is this a problem? Well, for one thing, this overhydration and this hyponatremia can lead to a swelling in your brain or cerebral edema. That can lead to seizures, and it can even lead to someone passing away. You may actually remember, and sadly, this has happened more than once, but specifically, there was once a radio competition where it was who can drink the most water the fastest. And you had these people who were chugging all kinds of water, gallons of water, as quickly as they could. And the female contestant who won actually ended up drinking so much water that the salt level in her blood dropped. She had hyponatremia and she got water on the brain or cerebral edema, and she ended up passing away. So remember, extreme dehydration and extreme overhydration can both cause problems. Now, what can you do? For one, consult with your doctor and find out how much water is safe for you to drink. For most adults, anywhere from 2 to 3 liters tends to be a good number. So if you think about those 16-ounce water bottles, drinking anywhere from 4 to 6 of those in a day is healthy for most people. Now, if you're someone with lung disease or heart disease, you may be on a fluid restriction. Consult with your doctor. Other than just drinking straight up water, there are other ways you can hydrate. You can eat foods that are very hydrating, like watermelon, cucumbers, celery, oranges, things of that nature. As far as overhydrating, make sure that you don't go over 2 or 3 liters without consulting with your doctor. The other thing you can do is let your urine be your guide. If your urine is really dark or amber or just like a really dark yellow, then chances are you're dehydrated. You want your urine to be a really pale yellow, almost clear. And if it is, then that's a good guide that you're probably doing well as far as drinking your water. Question: what is one small change you plan to make this week to better support your kidneys? Type it in the comments below. Number 3, ignoring or not managing your high blood pressure. Let me tell you right now, this is a very common bad habit that leads to kidney failure because high blood pressure is the number 2 cause of people being on dialysis. Yes, when I take care of my dialysis patients, the number 2 most common cause is from having blood pressure that's not managed. Now, here's the deal. When you have high blood pressure, it causes your vessels to constrict, right? It causes them to tighten. And over time, this leads to a poor blood flow or poor circulation for the kidneys, okay? And so you can get something called hypertensive nephrosclerosis, or basically kidney failure due to high blood pressure. Something that happens very commonly in my office is that people will come to me. They'll have blood pressure that is sky high, but then they'll tell me, hey, I don't have any symptoms. This blood pressure is fine for me. High blood pressure runs in my family. And so it's their habit to ignore their high blood pressure. Bad habit, because yes, even though high blood pressure does run in some families, you know what else runs in families? Salt shakers and frying pans. There are things that you can do. Number 1, consult with your doctor. Make sure you don't skip your doctor's visits and work with your doctor to manage your blood pressure. Also, I recommend that you monitor your blood pressure at home. A lot of times when you're rushing and hustling and bustling, you might have white coat hypertension or have a falsely elevated blood pressure in the doctor's office. But if you manage your blood pressure at home, okay, if you monitor it at home, then you'll have a better idea of what your true blood pressure is. Make sure you click the link in my description or visit dr.frita.com to find out some of my favorite blood pressure cuffs. Also, you want to make sure that you limit the salt or the sodium in your diet. According to the American Heart Association, most adults should have no more than 1.5 grams of sodium in a day. You should also exercise regularly in order to lower your blood pressure. Be sure to watch my video on the top 10 exercises to lower your blood pressure naturally after you finish watching this video, and click the link in my bio to check out my book, Under Pressure, A Guide to Controlling High Blood Pressure. Bottom line, ignoring or not managing your high blood pressure is a horrible habit that can lead to kidney failure. Number 4, following an unsupervised high protein diet. Now, y'all are about to be mad at me, especially those of you who are bodybuilders or who are trying to increase your muscle mass. And if you have a personal trainer or someone who's helping you, I know they're telling you high protein, that's the way to go for your muscles. Okay, well, here's the issue. If you have, totally normal kidneys, healthy kidneys, if you're well hydrated and you're not at risk for kidney disease, then sure, you may be able to handle a high protein diet. But if you are someone with risk factors for kidney disease, like high blood pressure, diabetes, dehydration, or some other kidney disease like lupus nephritis or focal segmental glomerulosclerosis, if you have kidney disease, CKD, or if you're at risk, then please listen up, because a high protein diet might not be for you. Here's what happens. When you eat a lot of protein, then that protein breaks down into waste products that must be filtered by your kidneys. And so the more protein you eat, the harder your kidneys have to work. So imagine if you already have CKD, or if you're dehydrated, or if you're at risk for CKD, then having a super high protein diet, especially if you're not supervised by a physician, can lead to kidney failure. So if you're in the habit of having super high protein and you're not supervised, then yes, this habit can worsen your kidney disease. Here's what to do. Consult with your doctor and first of all, find out about your kidney health. Ask about your EGFR, your BUN, your creatinine. Find out if you have protein in your urine. And if you have poor kidney health, or if you are at risk for having poor kidney health, then again, consult with your doctor and perhaps even ask to be referred to a registered dietitian. And so you know how much protein is a safe amount of protein for you. And I'll tell you, for many patients who actually already have chronic kidney disease, they might have to limit their protein to 60 grams a day or 70 grams a day. It depends. Either way, if you have kidney disease or if you have vulnerable kidneys, then having an extreme high protein diet could be pushing you towards kidney failure. This next one is hard to quit. Number 5, relying heavily on processed healthy foods. So what do I mean by that? A lot of you are definitely trying to be healthy, right? You have healthy habits. And one of your healthy habits might be to lead a vegetarian lifestyle or a vegan lifestyle. But if you're on the go, if you're really busy, if you don't always have time to cook, then you might rely heavily on processed, quote unquote, healthy foods like prepackaged or frozen vegetarian foods. For example, you might eat prepackaged frozen vegetarian chicken nuggets or vegetarian sausage that's prepackaged and frozen. If so, there are often a lot of chemicals in these ultra processed, healthy, quote unquote, vegetable diets. For example, just take a look at the labels and you might see if you get 2 vegetarian or vegan sausages, then those 2 sausages might have 300 milligrams of sodium. Well, in a day, it's recommended that you have no more than 1,500 milligrams of sodium. And so if you eat more than 2 sausages, if you eat 4, if you eat 6, then just in that one tiny meal where you're trying to be healthy, you could actually have a high sodium load, increase your risk for high blood pressure, which can lead to kidney failure. And so there you have it. This prepackaged, processed, healthy vegetarian sausage could be causing kidney damage, right? Also, the same thing with vegetarian chips, right? You'll see a lot of these veggie chips that are prepackaged and processed, but if you take a look, they are often high in sodium, or they often have things like phosphorus in them, which is something that could lead to kidney issues. The list goes on. There are a lot of quote unquote healthy protein bars that are processed and they can cause issues. And there are a lot of drinks, like certain juices that you might take in that you think are, hey, this is healthy, it's a juice. But if you look, it might be loaded down with sugar. And we know that high sugar intake can increase your risk for diabetes. And diabetes is the number 1 cause for kidney failure. So the reason I say that number 5 is hard to quit, because those of you who are trying to have healthy foods are the ones who really think that you have good, healthy habits. But if you rely on processed healthy foods, then this is a common habit that can lead to kidney failure. Okay, so what can you do about it? Number 1, be a label watcher. And so if you see that foods have high sodium or a lot of chemicals or a lot of phosphorus, then you want to avoid them. Also, ask your doctor to send you to a registered dietitian to talk to you about truly healthy foods that are not processed. The other thing you can do is start cooking at home. Plan your meals, do meal prep so that you're not starving and in a rut where you feel pressured to grab processed, quote unquote, healthy foods, okay? And make sure that you rely on whole foods like whole nuts, fresh fruits. Use fresh foods as opposed to ultra processed foods. Question: have you ever had to struggle to quit processed foods even when you knew they weren't the best choice? Please comment down below. Number 6, overdoing it with kidney cleansers and detoxes. Oh my goodness. As I mentioned, I am a board certified kidney doctor, and I can tell you that there is no one quick fix. If you see these infomercials, or if your cousin's friends, person, somebody up and down the street, if they told you, oh, I did this kidney cleanse and it cured my kidney disease, or I detoxed and now I'm 100% better, the chances are it's not true, okay? Trust me, I sit, I read the articles, I read the journals, And there's no one magic bullet that, boom, automatically detoxes or cleanses your kidneys. And sometimes when you purchase these kidney detoxes, these kidney cleansers, they can have these proprietary or secret blends, and they can actually have some supplements that are harmful to your kidneys. So please make sure you don't overdo it with kidney detoxes and kidney cleansers, and really don't do them at all unless you are consulting with your physician. So here's the truth of the matter. People talk about, cleansing out your kidneys. Yes, your kidneys are filters, but they're not filters in the same way that you have an air conditioning filter or a car filter where you can just take them, clean them off, unclog them, and boom, put them back. There's no one-stop shop, no magic bullet just like that as far as cleaning out your kidneys. Instead, there are a series of things that you can do under the supervision of your physician that can help your kidneys to filter better. You can do things like eating foods and fruits that are high in antioxidants. This can help to decrease inflammation in your kidneys, and that will help your kidneys to filter better. You can drink plenty of water to make sure that your kidneys are not dehydrated and having prerenal azotemia. That can help your kidneys to filter better. You can make sure that you maintain normal blood sugar levels and manage diabetes or prevent diabetes. That can help your kidneys to filter better. You can maintain normal blood pressure, okay? And avoid taking certain medications like the overuse of NSAIDs so that you don't damage your kidneys. There are drinks and juices that can aid in helping your kidneys to filter better, but just be sure that you are not falling victim to some of these gimmicks and people telling you, hey, here's a 100% guaranteed kidney detox or kidney cleanser. Don't fall for that, okay? Because overusing kidney cleansers or detoxes or these fake promises can actually, in some cases, worsen kidney function. Be sure you check out my YouTube playlist on kidney health, and I share with you foods that can help to repair your kidneys, and I share with you drinks that can help your kidneys to filter better. Number 7, taking certain herbal supplements blindly. Yes, this is a common habit that can cause kidney failure because, a lot of people want to be natural. They want to be holistic. And I actually do practice natural holistic medicine where I use food as medicine. I use exercise as medicine. I use lifestyle changes as medicine, right? Diet, exercise. But being that I am a traditionally trained physician, I also know when to use medicine as medicine. And I also know when supplements can actually harm your kidneys. This is why it's important to consult with your doctor when using supplements. And when your doctor asks for your medication list, please don't just give your prescribed medication. Talk to your doctor about supplements because, again, using some of these herbal supplements can actually lead to kidney failure. Because herbal supplements tend not to be FDA approved, again, they can have these secret ingredients, these proprietary ingredients. And sometimes the ingredients can counteract or have a bad reaction with medications that you're taking. And I've actually had patients who've taken certain herbs. For example, I've had a patient who was taking some Chinese herbs. The patient really didn't know what was in those herbs or what it was. They just were given a bunch of greenery and herbs in the bag. And that herb specifically was actually toxic to this patient's kidneys. It caused her to have a decrease in the amount of urine she made and a worsening in her kidney function. And so, yes, I know that's scary because when you're taking supplements and you're looking at things and you're like, oh, it says natural, it must be safe. Just because it says natural, it doesn't mean that it's safe. So what can you do? Consult with your doctor. Please do not take any herbal supplements unless it's under the supervision of your physician, okay? Because there are some herbs, some supplements, and some things that actually can be helpful or not harmful to the kidneys, but it's hard for you to know on your own. And if you don't allow your doctor to be a part of the discussion, then overdoing it with herbal supplements is one of those habits that could lead to kidney failure. We all have habits. We all have things that we do every day. And those things may seem perfectly harmless or benign to us, which is why I really wanted to come to you today and to have this conversation. If I have mentioned a habit that you actually have, or if you hear this habit and you're like, I have loved ones who do that, please make sure you share this video. As always, I appreciate your support and I look forward to seeing you in the next video, or hey, maybe even in my telehealth concierge service. Take care and be sure to do your best to live your healthiest, happiest life. I'm Dr. Frita.